My name is David Frim. I'm a neurosurgeon and chief of neurosurgery at the University of Chicago Medicine. When one thinks about congenital anomalies of the nervous system, we think of things that are not going quite right between the brain and the spinal cord and the nerves around the rest of the body. A lot of people don't understand these central nervous system anomalies. They don't know much about it. They don't know many people who have them. There's not a lot of resources available to ask questions about it.
Hi, we're the Hacketts. I'm Bill.
I'm Raynell.
And our daughter is Margaret Hackett, who was diagnosed at a very young age with craniometaphyseal dysplasia.
The Margaret Hackett Family Center is designed to provide hope and resources to patients and families who find themselves in a similar situation as we found ourselves when Margaret was first diagnosed.
When I first met the Hacketts, I had heard the name craniometaphyseal dysplasia, but really only in a textbook, in a paragraph or two. So Margaret educated me quite a bit about the whole thing. There are some people, like Margaret Hackett, for instance, who is born with a unifying problem where she elaborates several of these anomalies all at once. But she's one of the people who ends up with hydrocephalus and with a syrinx in her spinal cord and with Chiari malformation. So what an idea to try and put together a place where a lot of the doctors are in the know about these things, where they see a lot of these patients, where they have the equipment and the stamina to realize what's happening to their patients. What comprises the Margaret Hackett Family Center should be a repository of information, and to have, if not written out things that we've done, at least links to articles about disease entities and how they're treated and who the people are who are studying them and where those people are. Somewhat central to all of this is still the need for more research into as many of these central nervous system congenital anomalies. We need to have enough resources so that we can follow all the patients who are treated. We can find out what paradigms work best, what paradigms work for a little while but then need to be augmented. We need to find out what stuff we think is working but isn't working. Part of the effort is going to be putting together a consortium of neurosurgeons and neurologists and caretakers of congenital anomalies. Do research together, keep registries of the patients, find out what's going to be the best way to treat a problem. We would need resources to put together clinical trials and monitor the patients, keep track of everybody. Beyond that, there's a lot of basic science to do, but the advocacy here and the activism to take on these problems is going to be key to a lot of the things that we're trying to do. And every little step forward is a big win. Now we can start setting up shop and beginning to tell people that they can hopefully come read our website if they don't know exactly what the disease of their child is like. That they can email a question because somebody will actually know the answer. As we get more and more supporters and as we're able to reach beyond just the Chicago area or the Midwest with the information that can help the parents take care of their children and the children grow up to be as normal as possible, that the sky is the limit.